Hello everyone, I am Dr. Arpana and I welcome you all to my YouTube channel. I am very happy that you are watching this video. In this channel, I share with you some health tips. Along with that, we talk about some diseases, how to deal with the symptoms and what can be the homeopathic approach in each and every case. Now, before I start with today's topic, just a small reminder, if you have not yet subscribed to my channel, do subscribe to my channel and do not forget to hit the bell icon so that whenever I publish any video or whenever I am doing live consultations, you are always notified. So, let's start today's topic. Today, I would like to talk to you about stomach ulcer. Now, what is a stomach ulcer? Whenever there is any necrosis or degeneration or sore in the lining of the stomach, we call it as a stomach ulcer. So, today we will be talking about the duodenal ulcer and the gastric ulcers. So, first of all, what can be the causes for the stomach ulcer? So, the first cause is infection with H. pylori, that is Helicobacter pylori. Then if you use NSAIDs, that is non-steroidal anti-inflammatory drugs, so if you use it on a regular basis, then also stomach ulcer can happen. Then excessive smoking, too much of alcohol consumption can result in this condition. And there can be some condition in which the stomach is producing more of the hydrochloric acid and which is resulting in the necrosis or in the degeneration of the stomach lining. So, these are the possible causes for the stomach ulcer. So, now what will be the sign and symptoms? So, first of all, there will be indigestion, there will be pain, belching, sour eructations. So, we will be now talking about the key features of the duodenal ulcer and the gastric ulcer. Now, the duodenal ulcer is better after eating food. So, whenever the patient is having food, the pain will go. The patient gets up at the night and then because of the pain, and then after eating something the pain is better. So, in duodenal ulcer, pain is better after eating food. There can be some melena, which means that there is dark tarry stools, which means the stool is mixed with decomposed blood coming out from the ulcer. So, in case of duodenal ulcer, we can see in some cases we can see that there is melena associated. Then there will be deep tenderness in the right hypochondrium, deep tenderness in the right side of the abdomen. So, these are the features of duodenal ulcer. Now, what will be the cardinal features of the gastric ulcer? In case of gastric ulcer, there will be pain after eating food. So, there will be weight loss associated with the gastric ulcer, because whenever the person is trying to eat something, there will be pain. And in case of gastric ulcer, the pain will be in the middle, in the middle of the abdomen, in the epigastric region. There will be deep tenderness in the epigastric region in gastric ulcer. In case of duodenal ulcer, it will be on the right side of the abdomen. In the gastric ulcer, it will be in the middle of the abdomen. Then, because there is pain while eating food, so there will be weight loss associated with the gastric ulcer. And in gastric ulcer, we can find in some cases that there is hematemesis, which means there is vomiting of blood. In case of duodenal ulcer, the blood will come in the stools. In case of gastric ulcer, the blood will come through the mouth. Now, there are some triggering factor which can trigger these gastric ulcers or the duodenal ulcer. Stress is a very big factor to precipitate duodenal ulcer, whereas if a person is not eating meals at a proper time, if the person is fasting, or the meal which the person is taking, that is not nutritious enough, that is not a balanced diet, then also gastric ulcer can occur. So, these are the key features of duodenal and gastric ulcer. Now, let us know how to manage these two cases. So, first, as I said, that the ulcer is because of the H. pylori infection. So, we need to eat some food which can fight this Helicobacter pylori from the body. So, the food which are good in fighting the H. pylori, they are all kind of probiotics and fermented food. So, in probiotic, you can take curd, you can take yogurt, you can take buttermilk, that is chas or lassi. In fermented food, you can take kimchi salad or sauerkraut. Now there are some fruits and vegetables also which are very beneficial in this. So in fruits, apples and all kind of berries like strawberry, raspberry, then your blueberries, then cherries, they are very good. And in vegetables, all kind of green leafy vegetables like spinach, kale, fenugreek leaves, then cauliflower, radish, carrot, they are also very good in fighting the H. pylori. Then honey, honey is also very good. Olive oil, so you can drizzle the olive oil in the salad or you can make some vinaigrette, they are very helpful in this case. Then licorice root, which is also known as mulethi, that is also very good in this. Then turmeric, turmeric is a very important and very powerful ingredient. Turmeric acts as an antiseptic, it acts as an antibiotic, it acts as an anti-inflammatory food. Turmeric has a compound which is known as curcumin, and that is very beneficial in fighting many diseases. So this is about the food. Now what all food we need to avoid? So you have to avoid any caffeinated drinks, you have to avoid chocolate, smoking, drinking, then you must avoid spicy food, fatty food and all kind of aerated drinks. So if you follow these precautions, you will see that the symptoms are better, you will get relief from your symptoms. So now let us know about the homeopathic approach. So what all medicines are there which can help you? So the first medicine is Argentum nitricum. So in Argentum nitricum, we see that there is heaviness in the abdomen, there is pain in the abdomen and the pain radiates to the whole abdomen. Along with that, there will be sour eructations. Then the next medicine is Nux vomica. Like I said, in case of gastric ulcer, there will be weight loss and there will be pain immediately after eating food. So all these features we find under Nux vomica, and along with that, Nux vomica patients, they generally have a habit of taking stimulants. It can be in the form of smoking or it can be many cups of coffee per day. It can be alcohol, and they are generally the people who will remain awake late till the night, late night scholars. So they are generally Nux vomica patients. So Nux vomica will give them relief. Then for gastric ulcer only, when there will be acute weight loss and there will emaciation, in that case Hydrastis is a medicine which can do very well. Then we have a medicine which is called as Kali Bai. In case of Kali Bai, the patient will be able to say that there is pain in a particular portion, maybe in a circular portion in the abdomen. So the patient will pinpoint that place and will say that there is burning in particularly this part of the abdomen. So if that is the case, then Kali Bai is a very good medicine. Then there are some people who will say that whatever they eat, it will just turn up into gas. There is so much of gas in the abdomen, there is so much of belching, so much of gas formation. So in that case, Carbovich can help. Now some person may say that the sour eructations, the heartburn, the retrosternal burning, that is all better when they are drinking something cold. It can be cold milk or cold water. So in this case, phosphorus is a medicine which can help them. Now the same condition, if the patient says that they are better by drinking something warm, then Lycopodium is the medicine. So likewise we have many other medicines. Now if you want to know about the medicine that will suit you the best, then do not forget to write me in the comment section. I will definitely try to help you out, and at the same time you can always join my live consultation as well, and we can take up your case in my live consultation. So I hope you like the information. So do share it, and do not forget to like the video, share it with your family and friends. And once again I would like to say that do subscribe to my channel if you have not yet subscribed to it, and also do not forget to press the bell icon so that you are always notified whenever I am publishing any video or whenever I am going live. So that is all for today. Hope you enjoyed it. Thanks for watching. Keep smiling, stay happy, stay healthy. Thank you.